Mr. Bode Ago, who is ably represented here this morning by no other than the Director of Service Matters,
incomplete. Today, as we celebrate not only the remarkable achievements of Lagos State Blood Transfusion Committee, but also the dedication and hard work of all those who have contributed to our success, our pioneers, our staff, our volunteers, our donors, healthcare providers, our partners, community organizations, government agencies, and other stakeholders. It is through your collective efforts and unwavering support that Lagos State Blood Transfusion Committee has been able to fulfill its mission of providing safe and accessible blood transfusion services to the countless individuals whose lives depend on our work. As we gather here today, let us take a moment to reflect on the journey that has brought us here at this point. We remain steadfast. We renew our commitment to the noble cause of saving lives and making a positive impact on our community through the gift of blood. Let us also look forward with hope and optimism to the future as we continue to innovate, collaborate, and strive for excellence in all that we do. Once again, I extend my heartfelt welcome to each and every one of you, and thank you for being here today to celebrate our milestones with us. Your support and participation are deeply appreciated. May today's celebration be a joyous and memorable occasion as we come together to honor the past, to celebrate the present, and to embrace the future of Lagos State Blood Transfusion Committee. So on behalf of the local organizing committee, I say a happy 20th anniversary to Lagos State Blood Transfusion Committee. Thank you very much.
Distinguished ladies and gentlemen, I think she deserves another round of applause. Mr. Governor, sir, distinguished ladies and gentlemen, at this point, I would like to call a special personality amongst us this morning, a great achiever who defied all odds just to make today happen. Please join me to welcome the Executive Secretary of the Lagos State Blood Transfusion Committee, Dr. Bodwin Oshikomaya.
Thank you very much. I'm very happy to see everybody this morning. However, I'm wondering why we were so silent. No background music, please. It's a time to celebrate. It's a time to tell ourselves that, well done, good job done. So kindly permit me to stand on existing protocols. 2 decades ago, the vision of creating a robust and efficient blood transfusion service in Lagos State seemed ambitious and unimaginable. But through the dedication and collaboration of our founders, I'm happy you are all here. I'm happy you are all here because we wouldn't be able to do anything or to celebrate this day without this vision that you had. We have achieved, conquered, and overcome numerous milestones that once seemed out of reach. From our humble beginnings, where blood shortages and unsafe transfusions were significant challenges, we have become a beacon of hope for many, saving lives in line with our vision and mission. As we look around, I see a mix of people who have actively contributed to our success stories. And I say a hearty welcome to you on this 20th anniversary of the establishment of this noble agency, the Lagos State Blood Transfusion Committee. I welcome our political and administrative leaders, our medical personnel, healthcare managers, tireless volunteers, healthcare providers, and innovative stakeholders. You have all made the Lagos State Blood Transfusion Committee what it is today. While preparing for this emerald event, it has helped the agency reflect on its milestones over the past 20 years. We have saved over 1.5 million lives and recruited over 2 million blood donors, with only 10.2% of them being voluntary donors. Despite the increasing number of donors annually, like in many parts of Nigeria, Lagos State still depends on different forms of coercive blood donation. I am proud and delighted to inform our audience that the incidence of transfusion transmissible infections has reduced drastically from 7.5% in 2004 to 2.8% in 2023. Blood components have also been produced from 96% of voluntarily donated blood. Our team today, pioneering the path and shaping the future in blood services, is a testament to our identity. For 20 years, we have been trailblazers, we have been pacesetters, and we have been first in many things. It is important to note that Lagos State is the first state to enact a law for the establishment of the Committee of Blood Transfusion in Nigeria. We are the first to commence the use of WHO-recommended testing method, that is semi-automated ELISA technology. We are the first to formulate and implement the policy of full automation in blood screening technology. We are the first to own a pathogen reduction technology, the first with an active and well-structured hemovigilance program, the first in convalescent plasma collection and in the management of emerging infectious diseases. And this has allowed Lagos State to represent Africa in the first meta-analysis in the management of COVID-19 patients. I'm happy to say that it is possible that Lagos State is the first to have a female dominant board, even before the existence of the SDG goals of female equity. So really, it's been so good. We are pacesetters and will continue to be pacesetters. Today, we remember some of our landmarks and unforgettable key moments, one of which is the commissioning of this agency by His Excellency President Bola Ahmed Tinubu, GCON, whilst he was the governor of the state in 2004. We remember the signing of the blood transition bill into law, the inauguration of the first and second committees, and the exciting monitoring subcommittee visits to the increasing number of private and public blood banks. I'm happy to say that in Lagos State, we have 136 licensed private blood banks and 29 state blood banks. I don't think any state in Lagos State has such. Any state in Nigeria has such. Remember disasters and blood emergencies like the Safaji building collapse. I think that was the first time myself and Dr. Laya had a full experience on the field, and I will never forget the experience when I saw a donor have a reaction, and she told me, "It's okay, don't worry." Thank you very much for that experience, ma'am. We remember the Owo massacre, the Ikeja bus train collision, the Ebola epidemic, the COVID pandemic, and how our voluntary blood donors and well-meaning Nigerians rallied to save lives. We remember Dr. Olufemi Dada and Dr. Uwem Olushola Oyekon, who served as executive secretaries of the LSBTC with unmatched dedication, as well as every staff and committee members we have lost over the past years. May their soul rest in peace. May we please spend the next 1 minute in silence to respect the departed ones. May their souls rest in peace. Remember them for their ability to inspire everyone around them, their warm-hearted approach, their relentless pursuit of excellence, and their profound sense of commitment to their roles. As we celebrate our achievements, we are showcasing and assuring you all of our commitment to continuous service improvement as we enhance blood donor recruitment and retention through awareness campaigns, youth and stakeholders engagements, capacity building, training, and research. We are adopting technology in documentation and data management, upgrading the infrastructure of voluntary blood donation centers, and equipping them with state-of-the-art technology. We have prioritized quality and safety, and we will soon commission the LSBTC Quality Assurance Research and Training Center, which is located at Bagada. We are ensuring the implementation of our robust policies through the monitoring and enforcement of subcommittees to the Monitoring and Enforcement Subcommittee, and prioritizing the affordability of blood through Mr. Governor, Mr. Babajide Sanwo-Olu's initiative on subsidizing the screening and cross-matching fee. Mr. Governor, thank you very much for that initiative, but we want more. Though the Lagos State Blood Transfusion Committee has seen significant advancements driven by passion, strong political will, and technological innovations, we still yearn for more. Of course, it hasn't been easy. I'm sure every staff of LSBTC here and listening to us on here know that the journey has been tough. We aspire to elevate Lagos State Blood Transfusion Committee to the level of those in developed countries where systems are characterized by efficiency, reliability, and universal access. We eagerly anticipate the next decade when we shall have 100% voluntary blood donation, a standalone, all-inclusive blood transfusion service center. Mr. Governor, sir, we are waiting for that. We also anticipate and look forward to when nucleic acid testing will be a routine form of investigation. We look forward to a decade with blood information management system and data analytics. We look forward to automated blood collection and processing, the use of artificial blood substitutes, stem cell therapy, enhanced blood storage solutions with improved preservation to extend the shelf life of stored blood and blood products, especially platelet concentrates, and improved transfusion practices using patient blood management strategies and evidence-based guidelines. As we forge ahead, we are inspired by our progress and commitments. I believe that jointly we can pioneer new paths and shape a future where safe and adequate blood services are accessible to all Nigerians. Once again, man answers. Thank you for being an integral part of this journey. Your support, dedication, and commitment are our lifelines. We continue to work together to achieve our vision and make Lagos State a model for blood transfusion services in Nigeria and beyond. Please enjoy this celebration. Be an advocate for voluntary blood donation, and please be a voluntary blood donor. Thank you very much.
Distinguished ladies and gentlemen, I would like for us to just put our hands together for the Executive Secretary, Lagos State, once again, for a job well done. So, distinguished ladies and gentlemen, at this point, just before we have the goodwill messages, I want us to please put our hands together for the Chief Medical Director, LASUS, Professor Adetokunbo O. Fabanwo. To lead the goodwill messages, I would start by inviting the Chairman, Medical Guild, Dr. Moruf Abdusalam. Let's put our hands together for him.
Thank you very much. Good morning, everyone, and I would also like to stand on the existing protocol, but particularly like to mention the presence of the Honorable Commissioner for Health, Professor Akin Abayomi, and my own dear Chief Medical Director, LASUTS, Professor Adetokunbo O. Fabanwo. It's indeed an honor for me to be here this morning, especially to celebrate the milestone that the Lagos State Blood Transfusion Committee has achieved over the past 20 years. Over the past 20 years, it has been 2 decades of dedication, compassion, and impactful service to Lagosians and indeed Nigeria. The Lagos State Blood Transfusion Service, I dare say, has perhaps even done what the government of UK has not been able to achieve by reducing drastically the incidence of blood transfusion reactions to the barest minimum of 2.4% since the inception of this agency. I would like to say and also place on record that the Medical Guild has been a part of this remarkable journey. I recollect that in 2014, the Medical Guild instituted a voluntary blood donation exercise where we as doctors, not only as lifesavers, put down our own blood to be able to save humanity in our own contribution towards a voluntary blood donation drive. And between 2013 till date, we have continued to make it an annual event. So I would like to thank you once again for the invite, and I wish the Lagos State Blood Transfusion Service a very more fruitful and impactful service to Lagosians and to Nigerians. Thank you very much.
Thank you very much, sir. Distinguished ladies and gentlemen, just before we have more goodwill messages, I would like to respectfully recognize the Consul General of India to Nigeria, Mr. Chandonoli Karen. Let's put our hands together for him. And with him is the second Chancery Consul of India to Nigeria, Mr. Mahesh. I would also like to recognize the representative of the Permanent Secretary, Lagos State Health Management Agency, Tosin Awoshika. So at this point, I would want us to put our hands together for the Chairman, Healthcare Federation of Nigeria, Dr. Pamela Ajayi. Okay, she'll be joining us live on Zoom. So we are just going to have a video, just for a few minutes.
Your Excellencies, distinguished ladies and gentlemen, please permit me to stand on established protocol. I bring you greetings from Cairo, and I want to sincerely apologize for not being able to be there today. This is a very important day and a momentous occasion, really, as we celebrate the 20th anniversary of the Lagos State Blood Transfusion Service. Without this service, so many lives would have been lost, and I sincerely want to say thank you to all that have provided service here. Thank you for your selfless service. Thank you for your sacrifice. Thank you for your dedication, and thank you for your unwavering commitment to humanity. As I said before, without this gift of life provided by the Lagos State Blood Transfusion Service, so many lives would have been lost. The work that you do, the compassion with which you do it, the contribution that it has made to the medical and healthcare service in Lagos, and not just Lagos and beyond, is something that really cannot be quantified. So as we stand here today, or as we all sit here today at this symposium, I want to enjoin us not just to look back and reflect on the past 20 years, but also to join hands and commit to supporting the Lagos State Blood Transfusion Service over the next 20 years and beyond, and to commit ourselves to providing that support to ensure that we get more donations and we enable them to give more gifts of life going forward. I would like to sincerely wish us all happy deliberations today, and once more, congratulations to Lagos State and the Lagos State Blood Transfusion Service.
So distinguished ladies and gentlemen, at this point, we are going to have a short video documentary of LSBTC that would showcase the presentation of the founding healthcare delivery in Lagos State over the past 2 decades. Have a happy view.
A person who applies wrong blood to a human being is a killer.
We had discussed it several times with the Ministry of Health. They had a blood bank and so on going. But there are so many other blood banks, private and public, in the state that nobody knew exactly what they were doing. Everybody it was like a wild west. Everybody was just doing what they liked, and there was no coordination, no regulation, no standard operating procedures and things like that. HIV epidemic was on, and everybody was worried about the safety of blood because we know that it can be transmitted through blood transfusion. And we thank God that this law was passed just at the right time, so that we could now go ahead and have a blood transfusion committee of our own to be able to coordinate and regulate blood transfusion practice in Nigeria, in Lagos State, not in Nigeria, in Lagos State.
We had a situation where a lot of our pregnant women were dying either during pregnancy or in labor because they didn't have access to blood.
We strongly believe that death from postpartum hemorrhage is an avoidable death if only the right type of blood needed can be provided.
Considering the law, people were not aware. So the need for people to be aware about this transition to this new law became very important.
We now decided to get a list of the existing blood banks and to visit. And we were, what a shock. Some people were practicing in their sitting room. Some people were practicing in their office. The refrigerator would contain food and other things that are not supposed to be. It was actually a wild west. It was terrible.
They were in various locations, like even markets where they are selling meat, gari, rice.
And we now came back and said, look, something has to be done. You cannot practice. Many of these did not have, some of them didn't have trained personnel to even do the work.
At that time too, we saw there was no documentation. People don't write what they have done. Then their blood donors were from anywhere and everywhere.
Documentation is very important in the sense that we monitor our blood from the point of collection to the point where it's being transfused and thereafter.
There was an incident when a woman came and said that she had been transfused with HIV blood. And I went to work. You don't want that kind of label. And this is why we talk about tracking of donors. So, because we keep records, we look at the blood given to that woman. We look at our record that blood was screened. Then I looked at those who donated the blood and I went to their houses. Fortunately, I saw some of them, they agreed. And we tested those ones that actually donated and they were negative according to our record. So that was how that case died down. Otherwise, we would have been in problems. So we stress the fact that we must know where that blood comes from.
I really do appreciate our founding fathers and mothers in ensuring that we have this law that we are celebrating of, because that helps us to channel our activities in the national sphere, and we have a backing to take some decisions. So we have the governance and the law and the policies that helps us to respond to national issues and disasters.
Even in non-emergency situations, at least during my tenure, we had requests all the way from even Benin. There were people coming in from Babcock University Teaching Hospital and other places. We were able to rise to the occasion.
We are going to have more of the goodwill messages. So I'm going to invite the representative, League of Medical Directors of General Hospitals, Dr. Olunuga Juliana, who is the MD, Ebute Metta General Hospital. Let's put our hands together for her, please, as she steps forward.
Mr. Governor, standing on the existing protocol, this is my second time of doing this when I don't even know about it. But we want to, on behalf of the Medical Directors Forum, we want to say a big congratulations to BTS. We appreciate all that you have been doing for us with the general hospitals. The success of BTS is the success of the general hospital. So please one. In Lagos State. It is the success of healthcare delivery in the state, fighting for the safety and accessibility of blood towards the saving of everyone that needs it. The BTS has made healthcare delivery very easy for us. Like the PS talked about the postpartum hemorrhage and all that. Really, BTS has been there for us. We want to say a big thank you and congratulations. Thank you very much.
Distinguished guests, ladies and gentlemen, I'm inviting now the chairman, NMA Lagos, Dr. Said Babajide. Please let's put our hands together for him as he steps forward.
Thank you. The Honorable Commissioner for Health, the Permanent Secretary, Minister of Health, and my mentor, my Oga, my father, Dr. Fabanwo, I really greet. I follow the other existing protocol because if I don't greet my mentor, I'll be in trouble. Now, from Nigeria Medical Association, really appreciate the effort of the blood transfusion services in Lagos State. I was employed in Lagos State from 2000, and I've seen that the difference from that time till now. There is a lot of improvement. They have increased the number of screening center. Initially, was just in Island Maternity. I think Bagada, every place they have increased the number. I think now I even just give you Dr. Shikomaya. Anytime I call her, even in the night, she will make sure that she gets blood for me, no matter what. I really appreciate that. Now, before that, I'm asking for 3 requests from Honorable Commissioner for Health through the PS of Ministry of Health. Number 1 is that there's issue of blood, people getting blood, especially the pregnant woman. There's a law that says that people should not donate blood. We need to look at that. It's really important. People have to donate blood, especially those that want to give ANC. We have to look at it really affecting the blood service system in the hospital. Please, if they have to look at that policy again. The second one is the issue of synergy between the federal, the state, and the private, especially between Lagos State government and LUT. We had a case of a patient that need blood, and what we heard is that blood from LUT had to be screened again in Lagos State. Please, you have to look at it. The last one, we have to expand the screening system in Lagos State. Thank you very much.
Distinguished ladies and gentlemen, I have the representative of founding members of Lagos State Blood Transfusion Committee, Professor Ibirunke Akinshete. She's also a pioneer chairman of Lagos State Blood Transfusion Committee. Let's put our hands together for her, please.
Thank you very much. Please allow me to stand on existing protocol. Today is a one of the most wonderful days in my life to see this happening. Give yourselves a round of applause. I would like to congratulate the Lagos State Blood Transfusion Committee. 20 years ago when we started, when you planted this seed, when Lagos State took the decision to plant this seed to have a blood transfusion committee, many people were very nonchalant about the whole thing. Oh, it's one of these committees that will come, they will soon go, what will they achieve, and so on and so forth. But I am so happy to see that that seed has germinated into an oak tree with several branches, several supporters, which we did not imagine when we started off 20 years ago. I congratulate you. And I'm also involved with the National Blood Transfusion Center, and I say to them, you have a lot to learn from Lagos State, because Lagos State started. And they are doing so, because I always emphasize it is the only state in the Federation that has a law governing blood transfusion. Give yourselves a round of applause. And I am so happy that the government, Lagos State government, has supported this committee. And I'm very happy that so many challenges have been met, and the voluntary blood donation is something that can be reckoned with. At that time when we started, there were very few voluntary donors. It was a headache to get people to come and donate. But now the younger generations are being educated. They have different ideas from the old generation, who believe that if you give your blood, you're giving life away. And I'm so happy to see that many young people are involved. Dr. Shikomaya, the people that have gone before you, Dr. Laya, and so on, that Agbe Davis have done so well, and I congratulate. The Commissioner for Health, I thank you very much, because you've taken this very seriously, and you've supported not only emotionally, physically, and financially, and God bless you, and bless Lagos State. Thank you so much, and there is still a lot of challenges ahead. We've done 20 years, but I believe this is a point where we can sit down and say, let's do a SWOT analysis. What are our strengths? What are our opportunities, our weaknesses, and our threats? And see how we can then have a strategic plan for the way forward for the next 20 years. Thank you very much.
Please let's appreciate Mama once again until she sits on her place. Distinguished ladies and gentlemen, at this point, I'm going to let us put our hands together for an Amazon, someone who is passionate about healthcare administration in the state, a lover of nurses, and of course, doctor of health administration. Distinguished ladies and gentlemen, at this point, join me to welcome the Special Advisor to the Lagos State Governor on Health, Dr. Mrs. Kemi Ogunyemi, as she steps forward for our address.
Thank you. Good morning, everybody. Please, Mr. Governor, represented by the Honorable Commissioner, Professor Abayomi, my colleague, my friend, partner in crime, name it. Please allow me to stand on the existing protocol. He said that to me about me once, so that's why I'm repeating it. I got him this time. It is really, honestly, when I saw that video, the clip that they showed you last night, I was like, what? Really? And even watching it again, I was nudging Commissioner that, wow, I can't believe it. And we're shaking our heads. Honestly, it's kudos to you, Professor Kishete, Professor Alaya, everybody that really at the beginning, they saw that vision. They saw this and they said, no, we're not going to have this. And then they moved it forward. And 20 years on, look at where we are. It's really, really amazing. Please clap for them again. I know blood transfusion services has really, really improved over the years. Look at where we are now. And I remember maybe about 8 years ago, yes, about 8 years ago when I was in Health Service Commission, we had issues with wrong blood transfusion being given to the wrong patient. And because it involved so many people, from the lab to the nurses, to the doctors that prescribe, the lab, the nurses, checking and making sure people get the right blood, because we all know that giving the wrong blood could actually lead to death. And so the changes we've made, the policies we've brought in, the education, the training, and obviously when you have executive secretaries like Dr. Shikomaya, ever smiling, energetic, PS called her the most energetic ES he has ever seen. No wonder we have this kind of thing. And she listed the first. I'm so proud to be a Lagosian. I'm so proud to be in the Ministry of Health. Because when she was listing all the firsts, in case you missed it, I would like to repeat it. I mean, apart from the fact that I do not have a speech, so you give me time to say something. The testing method. The first to formulate and implement the policy of full automation in blood screening technology. The first to own a pathology reduction technology. The first with an active and well-structured hemovigilance program. And the first in convalescent plasma collection in the management of emerging infectious diseases. Honestly, come on. We're not echo for show for nothing. We are honestly Action Lagos, Center of Excellence. We put the right people in the right jobs. Dr. Oshikomaya is one. And I just believe in collaboration and working together as a One Health family. In all seriousness, though, I mean, I was serious earlier on, but even more serious now. We need to continue to strive to be the best. We're not, we are the best, but we need to, through research, through data collection, through working together, we can make this health service, and especially the blood transfusion service, even better and be ahead and be a par with all the other people that we have in other countries that are developed. So I really want to thank you for what you do. Everybody in that beautiful Ankara that you've won, I think we should just clap for every single one of them, please. They are really, really working hard. And so as we move forward, Dr. Shikomaya, yes, we need to start having our own FFPs, all the irradiated blood products that we need, especially as cancer services grow, because I know we had issues there where so many people needed irradiated blood, we didn't have it. Having blood on time, encouraging more people. A lot of people still do not know that it's important to donate blood, that they may be the ones that will need it one day. We're still saying, go and get your family members to donate blood. So we need to, and the PSCs in the districts are here, encourage your people to donate blood. And because they save one blood unit can save a life, can save 2 lives. You just never know, and it doesn't have to be an adult. So we need to continue what we're doing right now and make it better. And I really wish you a successful celebration. Today is not the only day you're going to be celebrating. Continue celebrating. I thank you for every single thing you do all the time, because this is really, 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 really important, and we don't talk about it well enough. I'm going to leave the rest for Honorable Commissioner to talk about. I don't want to steal his thunder. Otherwise, I'll just be saying all the things he's going to say. But anyway, thank you so much for inviting me. Have a fantastic day. Thank you.
Please let's put our hands together for the special advisor once again. At this point, I would like to recognize the CMD Luth, Professor Wasiu Adeyemo, who is ably represented here by the Deputy CAMC Clinical Services, Dr. Babawale Bello. Kindly stand up for recognition, please. I would also like to acknowledge the NYSC Director, Lagos State, Mrs. Yetunde Baderiwa. So, distinguished ladies and gentlemen, just before we have a short video documentary, I would like to invite the Consul General of India to Nigeria, Mr. Chandraoli Karen, for his goodwill message. Let's put our hands together for him.
Good morning, everybody. Thank you for the kind invitation to this noble program and the people who are working for this noble cause of blood collection and maintaining the line of supply of blood to the needy people. What I understand that the 1 pint of blood can save 3 lives. So we can understand the invaluable services the Lagos State Blood Transfusion Committee are doing. So many congratulations to them all, and thank you for what are you doing. I am also here to underscore a thing that Indian community is one of the largest blood donors in Lagos State program. When I joined my consulate in Lagos on my diplomatic assignment, I was not very sure that why am I getting so many invitations for a blood donation programs. Then I saw that every community organizations are partnering with Rotary, and then they are partnering with Lagos State Blood Transfusion and collecting sometime 50 pints of blood, sometime up to 100, sometime more than that. And all the community organizations were competing among themselves that let me have these many pints this time. I would like to mention that there is a temple in Ilupeju and there is a Rotary hall there. And most of the time on all the important functions there is a blood donation camp ongoing in that place. All of your nurses or blood transfusion committee will be knowing that this is the. I have the privilege of inviting them once on the occasion of a birth anniversary of Mahatma Gandhi in our consulate to organize a blood donation camp. And your team was marvelous. I would say that they were thoroughly professional. I have no doubt in accepting that they were not less than any developed system. So I congratulate them for that, and I congratulate you on the 20th anniversary. Maybe you should have more celebrations like this. I just want to mention one small thing, which I have the practical example, practical, experience in my life. And maybe you are doing, I don't know, but I just want to remind that when we take the blood, you will be screening it, I hope. But sometimes this screening is to understand whether this is a good blood to transfuse or not. But in India, they screen it for the problems in the donors also. And the discussion you were having that we should have a document, exact documents, then they inform the donor that, sir, you have some problem in your blood and we sponsor your treatment. So if you can find this way, that this can be a good attraction for the blood donors, that you say them, sir, you have slight problem in this and you can go to our any doctor for your treatment. It is done in India through the Rotary. So this can be a good attractive point. With these words, I congratulate you all and thank you.
Distinguished ladies and gentlemen, let's appreciate the Consul General once again. Distinguished ladies and gentlemen, at this point, I would like to recognize my very own permanent secretary, the person on whose authority I'm standing here this morning. I have the pleasure of introducing to you the permanent secretary, Lagos State Minister of Information and Strategy, Mr. Olumide Shogunle. And also, I would like to recognize the permanent secretary, Minister of Women and Poverty Alleviation, WAPA, who is ably represented here this morning by Mrs. Ogunlewe Olufunke. Let's appreciate her once again. So at this point, we are going to have a very short video documentary of Lagos State Blood Transfusion Committee. Happy viewing.
I see a future where a patient needs blood. There's instant information to where they're going to get that blood from. The access to it is easy. Getting it, there's not a 24-hour, 48-hour time limit which the patient may not have.
The first potential I'm thinking about is full automation of services.
I see where the process is all electronic.
We have already taken the first step. We have said that we are automating our screening processes. Right now with the policy, we have been screened for transfusion transmissible infections. What I mean is HIV 1 and 2, hepatitis B, hepatitis C, and syphilis in a fully automated system. You don't have to have the semi-automated or where we have the interference of manual processing any longer.
I see skilled people, well-trained.
More technical staff, training and retraining. In another 20 years, I want to see that in Lagos State, not only Lagos State, in the whole of Nigeria, we deal with only voluntary blood donors.
I'm looking for the situation where we have 100% voluntary blood donation.
Because they have been said to be the foundation of safe blood.
I foresee a blood transfusion service that can meet up with the WHO's mandate of 1 to 2% of that community providing blood. I foresee a reality in Lagos State such that we can have at least 220,000 units of blood per annum. I really look forward to it. I foresee blood transfusion service that at every corner, they are going to be able to donate blood.
Strategic points that people can actually walk in, not too far from their offices or their homes.
Our donors don't need to wonder that, oh God, when will I have to go to this particular center that is kilometers away? They will just go to the next street and they can find somewhere to donate blood voluntarily.
Standalone centers that people can actually walk in. We operate public holidays, we will operate weekends, and people at their own free time will come in and donate blood, not even only blood, so that they can actually donate platelets, blood products as well.
Also foresee a blood transfusion community where we could make blood products and drugs from our blood. There's so much wastage of plasma here, and if we don't waste it, we can make more products. Things like coagulation factors, which are so expensive. Things like Rogam, which are very expensive. We can collect all that plasma, things like albumin. People need this, and we can get it from the plasma, make it into pharmaceutical products, and give it to people at a cheaper rate. I foresee such a blood transfusion service.
I want to see a standalone blood transfusion service. I would love to see the service have a bigger standalone facility.
So if you go to any developed country, their blood transfusion service is a standalone institute.
So that everything can be in one place. A place where everything starts and ends as far as the policies and the activities are concerned. They need to get more visibility. They need to let the people know that they are there and they are there for them to protect their interest in having safe blood for transfusion.
So you want to be able to be sitting in Lagos and know that at any point in time, if I or anybody close to me or a loved one or any colleague needs access to a blood or a component of blood, that I can put my hand on my chest and say, I trust Lagos State. Lagos will not fail its citizens.
And I see a future where the patient will not have to wait indefinitely or die from lack of not getting blood transfusion, and then they do not have to pay for it.
I foresee a Lagos State blood transfusion committee that we could sleep and be rest assured that every unit of blood
that is transfused anywhere in every appropriate or registered healthcare facility will be safe and without any means of quackery.
Distinguished ladies and gentlemen, at this point, we'll be having our anniversary lecture, and it's going to be done by no other than the Major General Dr. Abimbola Olatilewa Amusu, MNI. Please let's put our hands together for her as she steps forward while I go through our citation. It's a long one because it's no wonder she's a Major General. Major General Dr. Abimbola Olatilewa Amusu, nee Isaacs, is a distinguished medical professional with a rich academic and military background. She studied medicine in the University of Jos, graduated in 1984, and holds a Master of Science in Hematology and Blood Transfusion from the University of Lagos, a Master of Business Administration specializing in health management from Lagos State University, and a certificate in leadership and management in health from the University of Washington. As a fellow of the National Postgraduate Medicine College, Faculty of Pathology, fellow of Chartered Institute of Logistics and Transport, and the International Society for Quality in Healthcare, she has made a significant contribution in the field of medicine. Commissioned into the Nigerian Army in 1982, Major General Amusu served in various capacities, including staff officer medical in Mogadishu for the United Nations operations in Somalia. She held key leadership roles such as coordinator Armed Forces Program on AIDS control, head of pathology departments in the two biggest military hospitals, Commander 2 Division Hospital Ibadan, and medical director of Military Hospital Ikoyi, and the 44 Nigerian Army reference in Hospital Kaduna. She was a commander of the Nigerian Army Medical Corps from December 2015 till her voluntary retirement in 2017 after 35 years of service. Having achieved the rank of Major General, making her the second female to attain this rank in the Nigerian Army and to command the medical corps, I think she deserves another round of applause, even though this profile is very large. But I'll have to jump to the last paragraph. She's a member of several professional bodies. Major General Amusu is an alumna of prestigious institutions such as the African Center for Strategic Studies and the Nigerian Institute for Policy and Strategic Studies, KU, Nigeria. She serves as a trustee of Women in Logistics and Transport and is actively involved in initiatives promoting sustainable access to healthcare in Africa. As a foundation fellow of the Nigerian Academy of Medicine and a member of the board of the Center for Sustainable Access to Health in Africa, she continues to make significant contributions to the advancement of healthcare in Nigeria and beyond. Distinguished ladies and gentlemen, I present to you Major General Dr. Abimbola Olatilewa Amusu, MNI.
Well, acknowledging first His Excellency the Governor, ably represented here by the Honorable Commissioner for Health, and all the distinguished persons who are seated here. The protocol has already been established, so we wouldn't spend more time on that. I want to thank the local organizing committee and the Executive Secretary of the Lagos State Blood Transfusion Committee for asking me to give this address. Most of the things I'm going to talk about, we have also come across it, either by the documentary or also in comments of people. But of course, because it is traditional that at occasions like this, there should also be an address to be able to commemorate what we're celebrating today. So blood transfusion, we know, is an indispensable component of healthcare. It helps to save millions of lives every year in both routine and emergency situations. It also enables increasingly complex medical and surgical interventions to be done, and therefore improves life expectancy as well as the quality of life of patients with a variety of acute and chronic conditions. Patients who require transfusion as part of their clinical management have the right to expect that sufficient blood will be available to meet their needs and that they would receive the safest possible blood. Sadly, however, many patients still die and suffer unnecessarily because they do not have access to safe blood transfusion. Blood transfusion service in colonial Nigeria and the immediate post-independence period was fragmented and unregulated. It still remains so in many parts of our country, despite the establishment of the National Blood Transfusion Commission. The idea of a blood transfusion service was first conceived during the tenure of Dr. Moses Majekodunmi as Minister of Health, and this led to better standards of blood banking in Lagos, as that was then the federal capital. And the blood transfusion unit of the pathology laboratory of the Island Maternity Hospital was the nucleus of that effort. Thereafter, blood transfusion services remained essentially hospital-based, from donor testing, blood collection, testing, cross-matching, storage, and disposal. And blood donations then were mainly from family members or paid donors, who typically are at a greater risk of transfusion transmissible infections than the voluntary non-remunerated donors. Even a study done in one of our teaching hospitals in Nigeria showed that the remunerated donors have significantly lower hemoglobin concentration and hematocrit than the voluntary non-remunerated donors. So we see that apart from the risk of transmitting infections, also the quality of blood is also not as good. The goal of blood transfusion is to provide safe, adequate, and quality blood and blood products for all patients requiring transfusion at the right time and for the right reasons. Hence, very often we talk about the appropriate use of blood. According to the WHO, a major barrier to universal access to safe blood transfusion is ineffective and inefficient blood supply systems. Now, when the supply system comprises of many small-scale establishments, as we see in hospital-based transfusion services, the quality of the blood and products cannot be guaranteed. Centralization optimizes the use of resources and therefore reduces costs and also reduces wastages. It enhances resilience in emergency situations that affect blood safety and blood supply. It is therefore commendable that Lagos State, the Center of Excellence, took the pioneering leap 20 years ago to set up the Blood Transfusion Committee and backed it with an enabling law. The effort of pioneering practitioners, as well as the support of government in achieving this feat, should continue to be appreciated and celebrated. Lagos State has been uniquely blessed with a good number of forward-looking, community-centered hematologists, scientists, donor organizers, and nurses who have contributed significantly to the success of transfusion services, not only in Lagos, but have made their mark in the country at large. I must acknowledge, and you would pardon me, my teachers, Professor Abasego and Professor Ibironke Akinshete, who is here, as well as my sisters, Dr. Fumi Olatunji and Dr. Olaya, in this regard. When we were being introduced, they said I was not a pioneer member of the Blood Transfusion Committee, but I think I was a pioneer friend because I have always been a friend of members of the Blood Transfusion Committee. So I want to thank them, as well as Dr. Adeto Agbeth Davis, who was the permanent secretary when this committee was formed. So definitely her office would have been the kitchen where a lot of the cooking was done. And we always say that success is incomplete without a successor. I think the Blood Transfusion Committee should be able to raise, the foundation of pioneer members should be able to raise their heads high and be proud that what they did has truly come to bloom, and it can only get better. Okay. I want to thank you, Dr. Shikomaya, and your team for this invitation and for keeping the flag flying. Very often I have reasons to call the blood transfusion service, and I keep having their numbers, and like has been said, I call them anytime. I also want to talk about two people I call, Mrs. Anima Shaun and Mrs. Ajala. Their phone numbers are always there. I always reach out to them, and we will get the blood, no matter the time of the day. So I thank you, because this has also made my own work easy as a hematologist. The National Blood Transfusion Service started in 2005, and that was after the Lagos State Transfusion Service. And it started as a partnership between the federal government and the US government, with funding from the US President's Emergency Fund for AIDS Relief, PEPFAR. And the legal framework that established it is the National Health Act of 2014. And the bill was only signed to establish its function as a commission on the 29th of July 2021. As a member of the National Technical Committee on Blood Transfusion that was set up by the then Minister of Health in 2004, I was privileged to see the quantum of work that had actually been done by predecessors on which the foundation of blood transfusion service in Nigeria was based. At this point, I would want to thank particularly somebody like Dr. Idris Saliu, who is sitting down here, and Professor Sego, because a lot of the work they did actually formed the basis of the act that is now in place. The number, the age, the distribution, and the disease patterns of any population would help to establish and estimate the blood needs of that population. We know now that the world population is increasing, and it is expected to continue to increase dramatically over the next couple of decades. And based on current trends, it is expected that by 2050, the world population would be about 11 billion. Now, 9 countries are expected to account for 1/2 of the increase in world population, and 4 of these countries are in Africa. Of course, Nigeria is one of the 4. The other 3 are the Democratic Republic of Congo, Uganda, and Ethiopia. Though sub-Saharan Africa has approximately 12% of the global population, currently it only accounts for about 4% of donated blood. We are therefore liable to shortages in this part of the world. With current population estimates of over 220 million people in Nigeria, and Lagos State expected to contribute about 17 million of this, our blood needs therefore are significant. And like we have been told, the WHO estimates that a population should have at least 1% of the population should be able to have at least 1% of the population is the minimum need of basic requirements for blood. So setting up this centrally coordinated blood service 20 years ago was therefore a visionary step, and we would continue to commend. In addition to ensuring the quality of blood and components in public and private health facilities within Lagos State, the visibility of the Lagos State Blood Transfusion Service has also come to bear in mass casualty situations where the service cannot just call out regular donors, but also provides it an opportunity to renew and to recruit new donors. We have been told of the many firsts that the transfusion service has been able to achieve. Currently, they have enrolled up to 2 million voluntary donors. This also is commendable. But we need to have donor retention strategies in place. In some countries like Switzerland, they even have more donors that are required than they require. And so, because they also ensure quality of the entire chain of the transfusion service, they are in a position to export their blood to other countries. I recall while serving in Somalia, part of my duties involved medical logistics, and I had to coordinate blood supplies. So we were actually procuring blood from Switzerland, because at that time, even though HIV, it was the early years of the AIDS pandemic, so blood donation was not allowed within the theater of operation, as we couldn't guarantee quality testing of the blood. With medical advances, especially where this involves treatment of serious illnesses and trauma, there comes an increase in transfusion of blood and blood components in order to improve patient outcome and to maintain health. About 234 million major operations are performed worldwide every year, with up to 63 million people undergoing surgery for trauma and 31 million more for cancers and another 10 million for pregnancy-related complications. In our environment, where diagnostic facilities and treatment options are more limited, most transfusions are prescribed for complications during pregnancy and childbirth, severe anemia in children, trauma, and the management of congenital blood disorders like sickle cell anemia. Access to safe blood could help to prevent up to 1/4 of maternal deaths each year, and blood transfusion has been recognized as one of the 8 life-saving functions that should be available at a facility of first referral. The tripod of health is traditionally identified as infrastructure, equipment, and personnel. I like to add the importance of processes, because processes is what actually links those 3 legs and makes them stand securely. So starting modestly from the 5th floor of the Island Maternity Hospital in 2004 and coordinating provision of safe blood across the state, the current status where the transfusion service would have a purpose-built structure is on the way. And that is evident of the commitment of the state government to infrastructural development and progress. Training and retraining of personnel would enhance their knowledge and skills, and the competencies so acquired will be brought to the provision of better service. The 3rd leg of the tripod is equipment. And though there has been an investment in equipment of the state, because we can hear that they have automation and third-party vendors, we are all aware of the ever-changing improvement in technology. The Blood Transfusion Committee should now start looking at standards to be set for the collection and screening centers as well, in line with current technology. So how will the Lagos State Blood Transfusion Service shape the future? Having pioneered a centralized blood service in Nigeria, and with the ongoing plans for infrastructural development, now is the time to start looking at new technology and being in the forefront. This will ensure that the service not only provides the required blood and blood components for the population it serves, but is able to further maximize the use of 1 unit of blood beyond even the 3 people that would have given it to ensure that the blood or the component is of the safest standard, and also reduce wastage so that we'll have blood or components for as many patients as possible. We have over 2 million voluntary donors recruited, and this should not only be a strong advocacy group, but also a source of blood always in the bank, as many of them should always be encouraged to return to donate after the first session. The service needs to continue to follow them up and celebrate them. And donors of blood groups, while being deferred when necessary, could also be stratified based on whether they donate whole blood or plasma. This is the time to embrace more automation. With the increasing number of voluntary donors, there's a higher proportion of regular donors and more people to spread the gospel and advocate for more donors. Automated blood group methods have a higher sensitivity and specificity when compared to manual methods. The agglutination is clear and there's less risk of errors. So the blood service could actually go further and help us to provide a true picture of the various blood groups and their distribution within our population. Quality management remains an integrated system of quality assurance that covers all matters that individually or collectively influence the blood or its components to guarantee their quality. It is an important attribute to emphasize in blood transfusion service as it shapes the future of transfusion service in Nigeria. It describes all the steps taken to achieve the safest possible blood for the recipient, from donor selection, more staff in quality management, and develop their skills in audit so as to ensure that all facilities that provide blood for patients in Lagos State key into quality management. I would also want to stress the importance of testing for transmissible infections. We're all witness to the impact of COVID-19 worldwide in 2020 and 2021. We are also witness to the giant strides and commendations that we received in Lagos State because of the way it was handled. Prior to this, we had the Ebola pandemic of 2014. In the health sector, we have been talking of emerging and re-emerging infectious diseases since the turn of the century. Transmissible infections continue to be a source of worry, and some of these infections are of significance in blood transfusion. Testing for syphilis to prevent transmission of treponema by blood transfusion actually started in the 1940s. It was followed by testing for hepatitis B using the surface antigen in the early 1970s. Then it was assumed that blood transfusion would be relatively safe and infections would not be iatrogenic. This, however, was not the case, and many people were infected with HIV as well as hepatitis B and C as a result of blood transfusion in the late 1980s and 90s. We saw what HIV wrought on transfusion as recent as 2 weeks ago, when the British government was bearing the brunt of infections transmitted early in the pandemic, when HIV testing was not universal practice. These errors, however, bring to fore the need for increased vigilance in preventing transmissible infections, appropriate donor selection, making it easy for donors to self-exclude, as well as testing, help to reduce the risk of transmitting infected blood. Starting with the first generation test kits, and now the third and fourth generation testing, up to 99% of HIV, hepatitis B, and hepatitis C can be identified. However, the less than 1% that is missed and the risk of emerging and re-emerging infections makes it imperative that the Lagos State Blood Transfusion Service should move now to the level of nucleic acid testing. Viruses like West Nile virus and dengue virus have been transmitted via blood and blood products. The European Center for Disease Controls has already classified the Chinguyana virus and Borrelia species, a bacterium that causes Lyme disease, as agents of concern, even though there is no reported case of a transmittable case in Europe. In North America, the list of transfusion transmissible infectious diseases includes viruses that are not yet known to actually cause blood to be transmitted in blood transfusion. But then they are already testing for it. The world is a global village, and with the mobility and frequent travels of Nigerians and to Nigeria, this risk should be recognized and steps taken. Though not all emerging infectious diseases currently pose a significant risk to blood safety or have been shown to be transfusion transmissible, we need to start taking precautions now to ensure the lowest possible risk occurs when a patient has to receive blood or blood products. The collection of blood of plasma directly from donors to cater for plasma needs, rather than collecting whole blood and separating into red cells, platelets, and plasma, is beneficial to the blood service. We know plasmapheresis is available in country, but with the large pool of donors available to the blood transfusion service, we should start the production of components, we should start the production of factors, and not just use it as fresh frozen plasma or platelet concentrates. Accreditation also remains a very important way of assessing or improving our services. It is a formal recognition by a competent body, proving that the blood service is qualified, is competent, and it complies with international standards. The Africa Society for Blood Transfusion has set up a stepwise approach to help facilities involved in transfusion get accredited. This stepwise approach has also been used in medical laboratories as the SLAMTA and SLIPTA, and has resulted in many laboratories in Nigeria getting the ISO 15189 accreditation. So it is time for the agency of blood banks, and they have been adapted to the uniqueness of the African environment. And the benefit of accreditation of the Lagos State Blood Transfusion Service is that the reputation will be further enhanced internationally, and particularly among its peers. The accreditation will be a visible evidence of the service's commitment to quality and to delivery of service and effective blood components. It also provides confidence that the organization is providing services that meet the highest standards. It provides an opportunity at the time of accreditation for the service to receive an objective feedback from well-trained and experienced assessors, and then they are able to take whatever corrective actions are required. Staff morale is always increased and improved as training and competency programs will help staff know exactly what they are doing. And for the clients that use the services, it gives an assurance that the quality of service delivery meets or even exceeds international standard. And it gives the knowledge that through the customer care program, clients can have an input into service delivery. I therefore look forward to the blood transfusion service being the pioneer accredited blood service in the country. Currently, I know that the National Laboratory Technical Working Group is already talking with the African Society for Blood Transfusion. And I think later this year, we're hoping that we'll be able to have a first cohort of training, and then we'll start looking for accreditation. I know the blood transfusion service, the Lagos State Blood Transfusion Service, has a hemovigilance program. But this is a time to strengthen and have it more centralized, and to ensure that the goal, which is a continuous quality improvement of the entire transfusion process, to improve both donor and patient safety, improve transmission appropriateness, and reduce wastage, and also getting a feedback from the final end users, will improve the quality of service and enable the appropriate indicators to be traced. Hospitals or people who are transfusing should be able to give a feedback even when there is a minor adverse reaction or any adverse event that can be attributable to blood transfusion. So there should be a way in which this is entered back and the service looks at it and collates and takes action as necessary. Concluding, therefore, as we celebrate the Lagos State Blood Transfusion Service on its 20th anniversary today, I want to particularly appreciate the voluntary donors who have made the provision of the raw material for this service, that is blood, available. This is also a good time to celebrate blood donors all over the world, in line with the theme of the 20th commemoration of the World Blood Donor Day, which actually comes up in another 10 days on the 14th of June. So June is actually a month of celebration in the blood sector in Lagos every year. So thank you. The theme this year is 20 years of celebrating. Thank you, blood donors. So thank you to our donors. Thank you to partners. And I want to thank the Lagos State government, the Honorable Commissioner for Health, for ensuring that this vital component of our health sector is receiving the needed attention. The Lagos State Blood Transfusion Committee pioneered the blood transfusion service in this country and is in good stead with all our support to shape the future. Thank you very much.
Distinguished ladies and gentlemen, I'm sure you all agree with me that retired Major General Latilewa Amusu stylishly gave us a military drill by schooling us on the rudiments of how to move the Lagos State blood transfusion forward. I think she deserves another round of applause. Distinguished ladies and gentlemen, at this point, we'll be having the cultural dance presentations by Lagos Arts and Culture Troops. Just before we have that, I would like to recognize the Chairman House Committee on Health of the Lagos State House of Assembly, Honorable Musibau Lawal. Let's appreciate him, please. The cultural dance presentations by Lagos State Arts and Culture. Distinguished ladies and gentlemen, just before we have the panel discussions, I would like to recognize the Permanent Secretary, Health District 1, Dr. Olufumilayo Bankole. Let's put our hands together for her, please. And also, I would like to recognize our very own special advisor on state development goals, Dr. Oreolua Fini. Let's put our hands together for her. Sorry about that. Let me quickly recognize our very own Omonile. Is a daughter of the soil. Let me introduce her once again. The special advisor to the Lagos State Governor on Sustainable Development Goals, Dr. Oreolua Fini. Let's put our hands together for her, please. So at this point, I would like to hand over the microphone to the moderator of the panel discussion. I have the pleasure of inviting the subcommittee lead of the Lagos State Blood Transfusion Committee, Monitoring and Enforcement, Dr. Samuel Alori.
Thank you very much. All protocol duly observed. Today is memorable in the life of Lagos State Blood Transfusion Committee. It is unique that 20 years ago, we are not at this level. And today, at this panel discussion, we are looking at the perspective in terms of the past, the present, and the future. And I have a panelist member who have been working in this field that ensure blood safety and also still passionate about this practice. We have a nurse who has distinguished himself in this blood transfusion service and has worked at various levels in the state. He is presently the Director of Nursing Services, Mrs. Adebukola Cole. You are welcome. We have a distinguished healthcare professional or blood transfusion medicine specialist who has been in this field and is currently a professor in the Lagos State University Teaching Hospital. Join me to welcome Professor Akinbami Akinshegun. We have a long-serving staff who has been with us. He's been working in the field and ensure that blood are screened and ensure that the results are accurate. He's one of the longest serving staff in Lagos State Blood Transfusion Service. Join me to welcome Mrs. Oluyemi Adegoke. I also have community leader or advocate in respect of blood donation. They have been partnering with Lagos State Blood Transfusion right from its inception. Red Cross is known for its role in ensuring that we have voluntary blood donors, and they themselves lead by example and also donate voluntarily in Lagos State. Join me to welcome the Secretary of the Nigerian Red Cross Society Lagos, Mr. Olakunle Lasisi. Last but not the least, we have representative of the Guild of Medical Lab Scientists, and this blood are screened. There's a partnership that works with the private blood banks. And to ensure that these safe blood are screened and give to people at the private blood level, we ensure that they also partner with us to ensure that all those blood are carried out as expected in the best global standard. Join me to welcome Mr. Abimbola Adekoya, Chairman, Guild of Medical Lab Directors, Lagos State. So, the table is set for this panel discussion, I welcome you panelists. I am the moderator, Dr. Alori Samuel, Head of Monitoring and Enforcement, Lagos State Blood Transfusion Service. I will start with voluntary blood donations. And Red Cross has been a partner for a long time. And I know the public plays a vital role in this situation. How was your public perception and participation in blood donation different 20 years ago compared with today? Let us have your own perspective.
Thank you very much, Mr. Moderator. At Red Cross, ever before the committee was established, our volunteers have been everywhere because we are emergency responders. So once in a while there's need for blood, our volunteers are always making themselves available, and good number of them are youths. So they are always eager to donate. But what we observe is that there are a lot of commercial donation, or should I say, those who are interested in collecting money before they can donate. But as the exercise continues, Lagos State Blood Transfusion Committee changed the whole story. We have been donating in different organizations and hospitals, but blood donation became an exercise of fun. A lot of things were introduced, incentive and different things. And new donors are always eager to be part of it. And we also observe that volunteers, they develop different styles when they're coming to donate blood. And some equally adopted celebrating their birthday as a means of canvassing for more people to be part of the exercise. A young man who did that recently, that happens to be one of our donors, he came with the media. He said he's going to visit the general hospital where the exercise is done. He mobilized, we have made available our vehicle, and he came with the media telling people that he's clocking 42 and he wants to mobilize 50 volunteers. You know, the orientation has changed. It's no longer, what are you going to do to donate blood? People are no longer scared and they are ready to take the adventure. Now at Red Cross, it's no longer maybe I've not donated, but it's about how many pints have you donated. Where you are the last exercise, and we have our own strategy. Apart from different units of the Red Cross, we equally reach out to people to get them encouraged.
Kindly enumerate on this strategy that you have put in place to ensure that people and the public donate voluntarily. Thank you.
What we've done is engaging the communities, the gatekeepers, and at the same time, we reach out to corporate organizations. Through the Lagos State Blood Transfusion Service, we collect flyers from them, which is a kind of IEC material. We need to engage them, talk to them. They tell us about their fears, their worries, and we let them understand that it's not how it works. Because the fact that your stature does not really determine who is going to donate or not. They are going to run some tests, and they will tell you whether you're fit. Even if someone is told not fit, we observe that the temperament or the kind of look the person have is not always too good for us, because he or she felt, why won't I donate, and he'll be willing to the next time. And as a matter of fact, we have our own way of encouraging them also, because we have a database at the Red Cross. Any activity you do as a volunteer is slotted into our database, and certificates are issued to every blood donor. So this is very encouraging, and it makes it easier for people to keep coming.
Thank you very much. Community engagement, database, and follow-up is very key. Now, when these blood are donated, we need to screen it. And screening is a process that is done in the laboratory. And I know that this blood must be safe. I have with me Mrs. Yemisi. What are the most significant advancements in blood transfusion service you have seen in recent years?
Okay, thank you. Of course, we will not be here if there is no safe blood in Lagos State. So the first thing I'm going to, there are so many points that are on ground, but I'm going to just say a few things. Of course, we cannot have safe blood if there is no screening. The first thing that I'm going to talk about is about the screening of blood by ELISA technique for TTIs, that is transmissible infections. That is the first one. Then the second one, the second advancement is that in Lagos State, as we proceed, you know, we have so many people in Lagos State, and the idea is that we must talk about voluntary blood donation. In recent time, we have been talking about voluntary blood donation, and is really yielding results. Then there is advancement, the reorganization and invigoration in voluntary blood donation drive. Another thing is that training has been done so many times by Lagos State Blood Transfusion for both private and public in order to give safe practice on blood. Then another thing is that Lagos State Blood Transfusion has gone a long way to ensure that everybody that is working in the lab knows what they are doing in the provision of SOPs and protocols and guidelines. So these points has made us, you know, to go a long way in Lagos State Blood Transfusion, and I think we have done well. And kudos to Dr. Abodunrin, our ES.
Thank you very much.
Yeah.
You have emphasized the need to promote voluntary blood donation and also training and retraining of staff. This is very key in ensure that quality practices are carried out at appropriate facilities.
Yeah.
And when this blood are screened, it is prescribed for patient by the doctor. And I have with me a professional, Professor Akimbami. What were some of the major breakthroughs in blood transfusion technology or technique that you witnessed in the early years, and what we have now?
Well, the most important to me is the discovery of ELISA machine, and that is what is presently used in Lagos State. Although it is not top-notch, like the ES has said this morning, the best we could get is the nucleic acid testing, which is still not available in any part of the country. But ELISA has reduced transfusion transmissible infection dramatically compared to the days when we were using rapid kits, you know, to do blood donation screening. So ELISA is the most important technology that is available in the past 20 years, that has been introduced in the past 20 years in Lagos State.
Thank you very much. When this blood are screened, prescribed, doctor, the blood is transfused in the ward. Nurses take control of that. And I have with me the Director of Nursing Services, HSC. Please, can you tell us your experience? What has been the role of the nurses in blood transfusion process in the last 20 years of your experience? Thank you.
Thank you very much, sir. As we all know that nurses play a vital role in encouraging clients, patients in donating blood voluntarily. And I'm going to use myself as an example. My days in Lagos Island Maternity, 2017 to 2021. And we have enough blood that we even give to other centers. And how do we come about this? We have committees that is being, our chairman is in the house, Dr. Committee in place. And our own goal or mantra then in Lagos Island Maternity is that no patient should die through any form of hemorrhage, be it APH or PPH. So we all know that thing drives us, and especially with the nurses, that we are 24 hours, we the patients. We took over the antenatal clinic. We were running it as our own clinic privately. We encourage the husband. I established the couples clinic, and I created a platform for our husband. Very interesting online platform, which we were able to educate them, informed information. And very interesting platform because we have a lot of questions. We taught them what is blood, the importance of blood. And at the end, we can see the results. People were just coming in to donate. So I believe that if we engage technology, if we as nurses can be passionate, can be there to encourage our clients, our patients, our families and relatives, then we will have more than enough blood in our blood banks.
Thank you very much. I can attest to that.
Thank you, sir.
During the course of monitoring on my experience in this field in the last 20 years.
Thank you,
It's
sir.
something we should promote. I will encourage you also to ensure that the nurses continue to play their critical role, not only in promoting voluntary blood donation, also the safety practices in the world. Lagos State also has partners with the private medical laboratory scientists. We have the Guild of Medical Lab Scientists here. Part of our responsibility is the fact that we monitor our blood from vein to vein, from the point of collections to the point of transfusion. Even thereafter, if there are any challenges, we still monitor to that extent. I have with me the chairman of the Guild of Medical Laboratory Scientists. When we go out for monitoring, we go to this private blood bank to ensure that compliance with the standard. What has been your experience at the private level in terms of blood safety in the last 20 years, prior, during, and prior to this enforcement of this law? Thank you.
Thank you, Mr. Moderator. It has been a beautiful experience. It was not like this before, and we have to thank the Lagos State Transfusion Committee. Dr. Olaya's submission the other time gave the clearer picture of what happened. Initially, before the Lagos State Blood Transfusion came on board, it has been, oh, to your tent, oh, Israel. Everybody seems to be doing it the way they feel they should do it. There is no coordination. There is no monitoring. See? But at the exception of this, Lagos State, everybody became conscious. We knew somebody is there to see what we are doing. And that has improved a lot of the system. Gone are the days that quack will be there to be giving blood. But these days, no way. You have to be professional to be able to do this. Gone are the days you hide under one table or one chair, you are releasing blood. No way. There's nobody that can do that. They have to look at your facility and make sure your facility is okay. So with this, we have, what are we talking? What about data collection? We are now together. We're able to discuss. We're able to talk. That was what brought about the formation of Lagos Blood Bank Society of Nigeria. Umbrella for we, all of us, we can as well discuss. GMAD is a bigger umbrella, but the coming of Lagos State blood transfusion has brought in the sanity needed for us to practice very well. It has been able to, the fear that some people are there looking at you, some people are there coming to see how you practice, has been able to encourage and improve the standard of practice. Thank you.
Thank you very much. We now have the second round of the panel discussion. How do you see blood transfusion in the next 20 years? I can give my own personal experience. We have talked about voluntary blood donations. We have talked about community engagement. We have talked about the proper screening. We have talked about compliance with standard. I can tell you, I never thought I would be in blood doing what I'm doing today. I remembered as an NYC
serving in a community. The wife of my colleague was anemic during pregnancy. I had to donate. Throughout my NYC, I donated 4 times. And the baby that was inside the womb that time, for over 30 years, is a medical doctor. He's married, and he's practicing well. You can see the joy that is involved in voluntary blood donation. And when I joined Lagos State 20 years ago, I found myself in this position as encouraged by Dr. Olaiya, who gave me the opportunity to serve. And I know service is very key. I want you to envision what I met in Lagos State 20 years is not what is operating now. We have moved higher and higher. So what are your expectations? And what do you think Red Cross can do, even your organizations can do in the next 20 years to improve on what we have now today?
Thank you very much, sir. At the moment, Red Cross is partnering with all corporate and NGOs, corporate organizations and NGOs. We are making our facility available for them to host blood drive. And our expectation in the next 20 years is that people will see at least 2 or 3 members of their family as a voluntary blood donor, and it's going to serve as the best insurance policy for every individual or family. What am I trying to say? If good number of us in our families have enough people donating blood, some of the dreams, expectations, as stated by the executive secretary, will be met. And we, at the end of the day, Lagos State will be supporting other states and even across the country, or even being a state to study on what they are doing on blood transfusion. So Red Cross is ready to cooperate.
Thank you very much. Give the mic to Nels. How do you motivate your staff to do more? And what is your vision for the next 20 years? Briefly.
Okay, to motivate my staff, I have to train them to make sure that they know what they are doing. And then I have to ensure that they are all comfortable when they are working. And then I have to make sure that the environment is conducive for them when they are working. And gone are the days when staff will ask their superior, they want to, go somewhere to go and do something. We don't really need to be rigid. We need to give them time. We need to, bring them towards us so that they will feel free with us. And in the next 20 years of Lagos State blood transfusion, I want to see everybody in the laboratory comply with quality management system, so that everything that we are doing, in our work, we need to ensure that we have safe blood in the laboratory, in the Lagos State blood transfusion. Thank you.
Over to you, Prof. Your expectation in the next 20 years.
In the next 20 years, I will expect that only the component of blood needed by anybody is given, rather than whole blood. And I also expect that the current rate of voluntary blood donation, which is still abysmally low, is increased from 10 to 20% as it is to like 100%. I will also expect that blood will be better processed than what is available now. I expect that we'll have irradiated blood for those that need it, leuko-reduced blood, CMV negative blood. So those are my expectations in the next 20 years.
Thank you very much. Over to you.
Thank you, sir. In the next 20 years, by the special grace of God, I believe that all of us there will be donors voluntarily. I can't hear you say amen. And that each and every one of us will be walking to the nearest blood donation center and we will donate. Because any nurse that you come across with will have given you that education that you need. I'm seeing Lagos State in the next 20 years that you will not have fear of being to donate blood, because we will have counseled you to erase your fear, your myths, your belief about blood donation. And I know that in the next 20 years, myself and my colleagues will be there to donate and lead, well, so that other people can join us. Thank you so much.
Thank you very much.
In the next 20 years, I believe then we will have all over the private mega blood transfusion center where the private blood bankers will be involved. Like somebody said the other time, mega centers in different local government where blood product and so many other things will be done. And we, the private blood banker, we want to play a significant role in that. Thank you.
Thank you very much for these panelists. Let's give them a round of applause. They've given their commitment, and I believe they've lived by their words. And I believe the audience will also join us in promoting voluntary blood donation and also partners with us in ensuring that we have voluntary blood in all. Thank you very much.
Just before you take your leave, we'd like to have a group photograph for the panel discussion, okay? Just quickly. Thank you very much. So distinguished, let's give them a round of applause, please. Distinguished ladies and gentlemen, at this point, I would like to recognize the following individuals and associations. The Executive Secretary of EFAMA, Dr. Mrs. Abiola Ido. Let's put our hands together for her, please. And of course, the League of Directors in the Lagos State Ministry of Health. Can you quickly stand up for recognitions, please? Thank you very much. And of course, I have the representative of Association of Medical Lab Scientists of Nigeria, Lagos State Branch, MLS Abioye Omoyemi. I also have representative of Medical Laboratory of Directors, Lagos State Branch, MLS Adekoya Abimbola. Representative of Blood Bank Society of Nigeria, Lagos State Branch, MLS Anore. Representative of Association of Female Medical Laboratory Scientists of Nigeria, Lagos State Branch, MLS Adejare. So distinguished ladies and gentlemen, we've gotten to the high point of this event, and I'm going to respectfully invite an environmentalist, the #1 health officer in the Lagos State, and of course, one health advocate. Distinguished ladies and gentlemen, join me to welcome the Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, who is ably represented here this afternoon by no other than the Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi. Please, can we stand with a standing ovation? Let's appreciate him, please, as he steps forward to the podium. Thank you.
To the members of the State Executive Council that are here, the Special Advisor to the Governor on Health, Dr. Mrs. Kemi Ogunyemi, Special Advisor to the Governor on SDGs, our own Dr. Ore Fini, the Head of Service, Lagos State, Mr. Bode Agoro, represented this morning by Mrs. Boko Oyekon Ismaila. Members of the body of permanent secretaries that are here, we have the proud honor of being the ministry with the most permanent secretaries in Lagos State government. And I welcome the Permanent Secretary of Health, Dr. Olusegun Ogboye, the Permanent Secretaries of the Health Districts 1 to 6. Thank you very much for gracing this occasion. And then the Permanent Secretary, PMO, Mrs. Adetutu Oshosonya. Thank you very much. Former Commissioner, Lagos State Ministry of Health, my friend Dr. Leke Piton, who is ably represented this morning by the Medical Director of Aurelia Agege General Hospital, Dr. Shola Piton. I think they are related. Former permanent secretaries that are here present, Executive Secretary, Lagos State Blood Transfusions Committee, the ever hardworking Tobodunrin Oshikumaya. Thank you very much for putting this great show together. Thank you for that wonderful lecture on the history of blood transfusion in Nigeria. Director of the National Blood Transfusion Commission, Special Guest of Honor, Professor Saleh Yehuda, represented by the Director of Regulatory Committee, Dr. Muhammad Lawal. Thank you very much. Chief Medical Director, I just want to acknowledge those persons that are here that have formed the foundation of blood transfusion and hematology in this country, and those that are not here. And I'm just going to mention a few names. And not many of you may know that apart from being a physician, I am also a hematologist. And so if I favor the Lagos State Blood Transfusion Service, it's because I have a special passion for blood and the use of blood. Several people in this room and several that are not in this room. And I start by recognizing Professor Essien, who is not here, who is late. Professor Wura Shokumbi, Professor Akinova, Professor Sego, Professor Akinonju, and Professor Akinshete, who is here this morning. And Professor Akomu, who is sitting at the back there. Thank you very much for gracing this occasion. These are some of the founding fathers and mothers of hematology and blood transfusion in Nigeria, who've worked tirelessly over the decades to establish a standard and expertise to make sure that we are able to provide this most valuable resource to our citizens. There's a gentleman sitting right in the corner to my right. We used to call him Salisu. And it's strange that nowadays we seem to be having a conflict between pathologists and laboratory scientists. But I tell you that when I was training in University College Ibadan, Salisu taught me how to cross-match blood.
He taught me how to run an ELISA. He taught me how to count malaria parasites. He even taught me how to grow malaria parasites. These are hardcore scientists in Nigeria that have defined the pathway of our scientific prowess. Now, in those days, the medical laboratory scientists really were in charge of the resident pathologists. And they taught us most of what we know. And the laboratory scientists would stop work around 6 or 7 in the evening, and the residents would take over in the night. And they would cross-match blood from 7 o'clock in the evening till 7 o'clock in the morning in busy hospitals like UCH, Luth, Lasuth, where people are constantly in need of this vital product. So I want to use this opportunity to thank all the medical laboratory scientists that have not only touched my life, but have touched the lives of all resident pathologists that have helped us to come and become who we are. And I want to take this opportunity to really appeal to cadres in the medical fraternity. There is no need for conflict. I love the panel discussion that we just had here, and it showed the value chain of safe blood, all the way from the community to the people that advocate for blood donors, Red Cross, Red Crescent, to the laboratory scientists that make sure you have safe blood, to the doctors that prescribe the blood, and to the people that ensure that the blood is safe, and to the nurses that are there monitoring the blood as it goes into the patient. And it is safe, and they're able to detect if there are blood transfusion reactions. So under our watch in Lagos State, we're hoping that we're going to put an end to the conflict between pathologists, between nurses, between medical laboratory scientists, between pharmacists. We are all doing a special job to keep Lagosians healthy. And I appeal to you, nobody can do what everybody else's specialty is. We all have our own special roles and responsibilities. And it is important that we're proud of the role that we are trained to do, and that we respect everybody else's roles and responsibilities, and we form that value chain that is necessary for delivering health care to our citizens. When I was trying to decide what subspecialty I was going to go into as a resident, and I looked around, I couldn't decide really, but something attracted me to hematology. And I don't know if you've picked it up, but hematology has a preponderance of very beautiful women. It is a very attractive discipline. They are not only beautiful, but they're extremely intelligent. And I'd just like all of us to give a round of applause to our beautiful hematology fraternity that have led the way in Nigeria. We've learned so much from you. We're so proud of you. And we're so happy that you're here today to celebrate with us here in Lagos State. So what is Lagos going to be doing moving forward? I think under the leadership of the Executive Secretary of the Lagos State Blood Transfusion, Dr. Oshiko Maya, we have a big plan. A plan to take Lagos to the next level. You've heard about the journey so far. The journey to make sure that this vital blood organ, and many of you don't realize that every time you get a blood transfusion, you're actually getting an organ transplant. Because blood is a liquid organ, and it comes along with a lot of technology and science. You don't just take blood from one person and give it to another person. And when you talk about blood, blood is made up of several components. And the art of blood transfusion into the future is the ability to break down that blood into several components and only give the part that the patient requires at that particular point in time. Let us not forget that it is an organ transplant. Every time you give a component of blood to a patient, you're giving an organ transplant, and it is to be taken seriously. I remember doing youth corps in the north, where we didn't have much access in where I did my youth corps. And I clearly remember young children and some adults actually expiring because of lack of access to a unit of blood. It is a very heart-wrenching thing to see somebody dying from lack of blood. And it is not something that we want to wish that any medical practitioner or medical cadre observes. So blood is critical. And so we in Lagos are not only going to make sure that the blood transfusion service has adequate infrastructure, and we are expanding access almost every year, not only in a central location but across our general hospitals. We are also trying to make sure that we move along with modern technology. You've heard some allusions to ensuring that every pint of blood or every component of blood that we use is absolutely safe and free of any possibility of a transmission of any type of blood infection, particularly HIV and hepatitis. And we're moving along the path of ensuring that we can guarantee, because even now, there's always a small chance that we may miss something, which is why voluntary blood donation is so important as opposed to paid donations. And we're going to make sure that in Lagos that we move along with global standards. And we ensure that we are using the most advanced technology to ensure that we're giving absolutely 100% safe blood in Lagos State. Dr. Boduri just came back from a visit in Switzerland, where she went to observe the most advanced utilization of science in the delivery of blood and safe blood to citizens. In another couple of months, a team will be going from Lagos to South Africa to go and look at the most advanced blood fractionating unit on the continent. A blood fractionating unit, thank you, is an advanced technology where you collect hundreds and hundreds of blood units and you put them into this machine, and this machine is able to separate the components into all kind of therapeutics that can be packaged and used as required. And this is the kind of technology that we want to acquire in Lagos State and in Nigeria to take us to the next level. Now, we've been talking about the committee that has been functioning for so long. This year, I have promised the blood transfusion service that together with Mr. Governor, we're going to try and constitute the blood transfusion governing board. For members with the right expertise to help develop that governing board to support the process of the trajectory that I have just talked about. Another thing that we're trying to do is to make sure that we move along with digital technology, and we're developing technological appliances that can ensure that we have the correct inventory, the correct way of fast-tracking information about blood transfusion in Lagos. As you heard, record keeping is absolutely important when you are giving a vital component like blood to our citizens. Now, having talked about all this success, there's something that still makes us sad in the Ministry of Health, and that is the fact that our voluntary donor rate is still on the low side. Every year, we collect about 130,000 units of blood, which is short of what we need, which means that certain people and certain patients go without access to this vital therapeutic. And so when we look at the demographic of Lagos State, the blood donating age group, usually young adults to about the age of 50, when we look at that demographic, there are at least 10 million to 15 million Lagosians that could qualify to donate blood. Out of that 10 to 15 million, we only see 130,000 donors. And that's even perhaps less, because some people donate several times in a year. So I'm going to use this platform to appeal to Lagosians, to appeal to Nigerians, that blood is a vital organ of life. It's a vital therapeutic. We cannot afford to be short of blood in our hospitals and in our blood banks. And therefore I appeal to all those that are eligible. If you're youngish, between the age of 20 and 50, you're well, you have no problem, please find out how you can donate blood to help your fellow citizens wherever you live, whether you're in Lagos or anywhere in Nigeria, or in fact anywhere in the world. We would like to reach targets of 1, 2, or 3 million donations a year, so that we can move into blood fractionating and that we can make Lagos a center of blood fractionating expertise and add to our economy and ensure that we are making components of blood safe and available and contributing to the pharmaceutics of Lagos State. So on this occasion, as I look around the room and I see a packed room of people that have come to celebrate with you, the Lagos State Blood Transfusion Service, the Ministry of Health, and all our friends, visitors, guests, and the press, I want to use this opportunity to thank every one of you that have contributed to the success of the Lagos State Blood Transfusion, the writing of the policies, the guidelines, the committees, the hours and hours of hard work. The fact that we can stand here today and shower accolades on the Lagos State Blood Transfusion Service and all those people that are wearing this beautiful Ankara. It has been a lot of hard work. And I must say that every time I take a memo or an idea to Mr. Governor around the blood transfusion service expansion strategy, he has never said no. And he has granted and continues to grant the wishes of the Lagos State Blood Transfusion Service. Dr. Bodurin, please stand up. This is the Executive Secretary of the Lagos State Blood Transfusion Service, an extremely hard-working leader, a visionary, A leader of all those people that are wearing the same outfits as you. Forever positive, forever trying to move to the next level. All of you that are wearing your Ankara, please rise up so that we can recognize you. Thank you very much. If not for this group of people, thousands and millions of people may have died in Lagos. So we acknowledge you, we recognize you, we thank you for your dedicated hard work. And I just want to say, on behalf of the Ministry of Health, and on behalf of His Excellency, Mr. Babajide Sanwo-Olu, we will continue to make sure that you rise from height to height and that you achieve your desire and your vision. Thank you very much and congratulations.
Please let's appreciate Mr. Governor once again, who is ably represented by the Honorable Commissioner for Health, Lagos State. Thank you very much, sir. Anytime the Honorable Commissioner comes on board, who is representing the Governor of Lagos State, I'm always tempted with the fact that I have to just go back to school to read medicine once again. Please let's appreciate him once again. Distinguished ladies and gentlemen, just before we have the awards presentation, we're quickly going to have just 2 minutes cultural dance presentations by the Lagos State Arts and Culture. 2 minutes, please. Distinguished ladies and gentlemen, at this point, we are going to have the presentation of awards. So I'm going to first call on the recipients of the awards. They will step forward, after which I would implore certain individuals to please present the awards to them. So my first recipient of awards today, I have the pleasure of inviting Professor Mrs. Ibirunke Akishete, and to please present her the awards to her. I will first of all invite the Mr. Governor, the Special Advisor, Lagos State Ministry of Health, the Permanent Secretary, Lagos State Ministry of Health, and of course the Executive Secretary, Lagos State Blood Transfusion Committee. She's going to back the Lifetime Achievement Award. Can you step forward, ma? Professor Mrs. Ibirunke Akishete is a distinguished dermatologist with notable qualifications, including MBCHB. This is much, oh. Mommy has really heard so much. She retired as Professor of Hematology and Blood Transfusion from the University of Lagos in 2003, having supervised numerous research projects and published extensively. As the pioneer chairman of the National Action Committee on AIDS, NACA, and senior special assistant to the president on HIV/AIDS 2000 to 2003, she initiated a multi-sectoral response to HIV/AIDS, securing international support. From 2005 to 2011, she chaired the Lagos State Blood Transfusion Committee, ensuring safe blood supply in Lagos. She also chaired PathCare Laboratories, achieving ISO accreditation in 2006. As founding president of the Society for Women and AIDS in Africa, Nigerian chapter, she earned numerous awards for HIV/AIDS prevention. Currently, she's a trustee and board member of APIN Public Health Initiatives and Lakeshore Cancer Center, and chairman of the medical board of Archbishop Vining Memorial Church Cathedral. She was married to the late Professor Alaba Akishete and is blessed with successful children and grandchildren. Let's put our hands together for Professor Mrs. Ibirunke Akishete. I'm now going to call on the Mr. Governor, the Special Advisor to Lagos State Governor on Health, the Permanent Secretary, Lagos State Ministry of Health, and of course the Executive Secretary, LSBTC, to please present the awards to Professor Mrs. Ibirunke Akishete.
Professor Ibirunke Akishete, on the occasion of the 20th anniversary celebration of the Lagos State Blood Transfusion Service, we would like to endow you with a Lifetime Achievement Award in recognition of your contribution to the discipline of hematology and transfusion in Lagos, Nigeria, Africa, and the world. We use this opportunity to congratulate you and to say a big thank you for your absolute dedication to this discipline. Congratulations.
The next representative of awards goes to Dr. Leke Piton, who is ably represented here this afternoon by no other than the MD General. Yes. Dr. Leke Piton, who is ably represented here by Dr. Shola Piton, who is the Medical Director, Orile Agege General Hospital. Dr. Leke Piton is the IHF advisor for Africa with a distinguished career in healthcare and education. He's a member of the Nigerian Academy for Science Forum and Evidence-Based Health Policy Making, Deputy Director of the Pittman UK Training Center in Nigeria. Dr. Piton held influential roles as the Honorable Commissioner for Education and Health in Lagos State. He was Chief Medical Director of Mayowa Hospital and worked as a medical officer at various hospitals. In 2005, he became the first African elected to the IHF Governing Council and served as treasurer from 2007 to 2011. His education includes the distinguished MBBS from the University of Ibadan and MPH from the Lagos State University. Dr. Piton is committed to enhancing healthcare access and quality of life in Africa. Please, let's put our hands together for him, please.
Former Commissioner for Health, former Commissioner for Education, King's College Old Boy, Floriat, Dr. Leke Piton. On the occasion of the 20th anniversary of the Lagos State Blood Transfusion Committee, and in recognition of you as the founder of this committee, and for your dedication not just to the Lagos State Blood Transfusion Service, but to the Ministry of Health, to the Ministry of Education, and to Lagosians in general, we are glad to honor you with this accolade as the Founders Award presented to you today and to be received by Dr. Shola Piton, the MD of Orile Agege, and also a hard-working member of the Medical Fraternity of Lagos. Thank you very much. You're honored this day.
Okay, the head of service Lagos State, Mr. Bode Aguru, ably represented here. Should please join the rest of the people. So the next recipient of awards goes to Dr. Adetoun Agbe Davis, who is the past chairman, LSBTC, and also the former permanent secretary, Primary Healthcare Board. Dr. Adetoun Agbe Davis, Permanent Secretary, Lagos State Ministry of Health. Dr. Adetoun Agbe Davis is a dedicated community health physician, as she has made significant contributions to healthcare and okay. Former Permanent Secretary, Lagos State Ministry of Health, ma. So let's appreciate her, please. Dr. Adetoun Agbe Davis, a dedicated community health physician, has made significant contributions to the healthcare and community service with a 28-year tenure as a medical officer of health in Lagos State and as a former permanent secretary at the Lagos State Ministry of Health. She also chaired the Lagos State Blood Transfusion Committee. She has a penchant for discipline and an advocate for blood donation. You have just proven that to me, ma. Please, let's appreciate her, please.
To Dr. Adetoun Agbe Davis, someone I actually personally know, former permanent secretary, Lagos State Ministry of Health, former chairman of the Blood Transfusion Board. Honestly, it's with pleasure that I'm glad I'm the one giving you this. Yes, really hardworking, dedicated, full of passion when she was leading the blood transfusion service. So this is to you during this LSBTC 20th anniversary celebration on this day, the 4th of June 2024. Congratulations. Excellence in Leadership Award. Well deserved.
Thank you.
The next set of award goes to Dr. Rafiat Olufumilayo Olatunji, who is ably represented here by our son. Dr. Rafiat Olufumilayo Olatunji joined the Lagos State Civil Service in 1984 as a medical officer too. She pursued Postgraduate studies in pathology, specializing in hematology and blood transfusion at Lagos University Teaching Hospital in 1988. A research on HIV and HBsAg prevalence in transfused patients with sickle cell disease revealed that children under 10 contracted HIV through transfusions, driving a commitment to save blood supplies. Distinguished ladies and gentlemen, please let's appreciate Dr. Rafiat Olufunmilayo Olatunji, ably represented by Aswan.
Okay. Congratulations to your mom, Dr. Olufunmilayo Olatunji. I know she was a former permanent secretary at Health Service Commission as well. This is a Founders Award presented to her during this LSBTC 20th anniversary celebration on today, the 4th of June 2024. Congratulations to her and all our best wishes.
The next set of awards goes to Dr. Modupe Olaiya, the past Executive Secretary, Lagos State Blood Transfusion Committee. Dr. Modupe Olaiya was born and raised in Lagos Island around Aroloya, Tinubu area. Aroloya. Sorry about that. Aroloya, Tinubu area, but hailed from Ikene, Iwomo. She attended St. John's School, Aroloya, Abeokuta Girls Grammar School, Grammar School, Methodist Girls High School.
Okay.
College, okay.
It is my pleasure to present this Excellence in Leadership Award to Dr. Modupe Olaiya during the LSBTC 20th anniversary celebration in recognition of her service to the Blood Transfusion Committee, her selfless and meritorious service to the Blood Transfusion Committee. Congratulations.
The next set of awards goes to Dr. Idris Ateiza Saliu. Idris Ateiza Saliu is the current director for Save Blood for Africa in Nigeria, with a background as a medical laboratory scientist. He has worked in research institutions, teaching hospitals, and universities from 1999 to 2002. Distinguished ladies and gentlemen, I present to you Dr. Idris Ateiza Saliu.
Mr. Idris Ateiza Saliu, one of my teachers. I am honored on this occasion, and I thank you for all the things that you taught me as a resident many, many decades ago. And I'm proud to be here today giving you this award, the Healthcare Excellence Award, in recognition of your contribution to safe blood, hematology, and science in Nigeria. During this Lagos State Blood Transfusion 20th anniversary celebration on 4th of June, we recognize you and we honor you. Thank you very much.
The next set of the next award goes to Dr. Alori Samuel Dari. He's going to bag the Long Service Award. Dr. Alori Samuel Dari, a chief medical officer, is passionate about blood safety, sickle cell disease, and HIV management. With over 30 years clinical and leadership experience across various health institutions, a University of Ibadan graduate. He has additional training in hematology, blood transfusion, healthcare leadership, and HIV management. Distinguished ladies and gentlemen, I present to you Dr. Samuel Dari Alori. Let's put our hands together for him, please.
It is my pleasure today to acknowledge the service of Dr. Alori, who has spent a lot of years in dedicated service to the blood transfusion service in Lagos State, and has pioneered a lot of the new innovations and supported his ES all through the work that they do there. And so it's my pleasure today to present this long service award to Dr. Samuel Alori, acknowledging his service during the LSBTC 20th anniversary celebration on the 4th of June 2024. Thanks for your service.
The next award will be presented by the Lagos State Head of Service, Mr. Bode Agoro, to the recipient, Bukola Bolariwa, the founder, executive director, IMA Health Initiative. Is she here? Is she here? Representative of IMA Health Initiative. Okay. Okay.
On behalf of the head of service,
Okay.
Mr. Bode Agoro, I humbly present the Community Impact Award to Mrs. Bukola Bolariwa during the LSBTC 28th anniversary celebration holding today, 4th of June 2024. Congratulations and thank you.
The next award will also be presented by the Lagos State Head of Service to the Nigerian Red Cross Society, Lagos State Branch. They are going to be presented with the Excellence in Blood Donation Partnership Award.
On behalf of the head of service, Mr. Bode Agoro, I present the Excellence in Blood Donation Partnership Award to the Nigerian Red Cross Society. We're really very happy and pleased for your contribution and collaboration over the years. During the LSBTC 20th anniversary, you've been on this journey from the get-go, so we are very grateful. The Lagos State government is appreciative of your support, and we celebrate you on this day, 4th of June 2024. Thank you. Thank you very much.
The next award will be presented by the Honorable Commissioner for Health, representative of the Governor, and the Permanent Secretary, Lagos State Ministry of Health, to VCare for Development Foundation. They're going to have the Blood Donation Champion Award. VCare for Development Foundation. Can we appreciate them, please, for a job well done? They've been contributing immensely towards the VCare for Development Foundation is a non-profit organization in Nigeria that to promote sustainable development and uplift of underserved communities. Since its registration in November, VCDF has been dedicated to building an inclusive society through integrated healthcare, education, gender, and social inclusion and sustainable livelihood interventions. Distinguished ladies and gentlemen, let's put our hands together for VCare for Development Foundation.
And the meritorious work you have been doing in community to ensure that we have the correct amount of youthful people donating blood, safe and safe use of blood. So we recognize you today with this Blood Donation Champions Award presented to your organization. Congratulations and keep up the good work.
The next award will be presented by Mr. Governor to Fighting Healthcare PLC. Fighting Healthcare PLC. Fighting Healthcare PLC. Representatives, are they here? Okay, please kindly step forward. Fighting Healthcare PLC, a leading Nigerian pharmaceutical company, was incorporated in March 1995. It has evolved from a local distributor to a major player in West Africa's healthcare landscape, driven by core values of innovation, excellence, passion, integrity, and ownership. Distinguished ladies and gentlemen, let's appreciate Fighting Healthcare PLC.
On behalf of the Lagos Blood Service Transfusion, Lagos State Blood Transfusion Service, and to all the donors that come, and you heard what the Consul General of India said, that when we have donors that come and we find that some of the donors have some medical conditions, it is our responsibility to not just have donors because we want their blood, but it's our responsibility to look after them when we discover that they have certain problems. And on this occasion, we like to recognize Fitson Healthcare PLC, because for 6 years consistently they've been providing pharmaceuticals to us to treat donors that we discover have anemia and other conditions. So on behalf of His Excellency, on behalf of Lagos State Government, on behalf of all the donors in Lagos State, and all the goodness that you have done for us, we'd like to honor you with this Corporate Partnership Award on the 20th anniversary of the Lagos State Blood Transfusion Service on the 4th of June, 2024. Thank you very much for your service to mankind. You're welcome.
The next award will be presented by the Special Advisor to the Lagos State Governor on Health to St. Nirankari Mission. They're going to have the Community Blood Drive Initiative Award. St. Nirankari Mission. Are they here? Kindly step forward. Over the last 90 years of its journey, the St. Nirankari Mission has become a synonym of oneness, love, peace, tolerance, selfless service, and compassion. Though these virtues are frequently quoted by many, the mission helps achieve them in a life through practical spirituality. Distinguished ladies and gentlemen, let's put our hands together for St. Nirankari Mission.
Thank you. On behalf of the LSBTC, we would really like to show our appreciation for all you've been doing for the past 19 years. This Community Blood Drive Initiative Award presented to St. Nirankari Mission, Nigeria, on the 4th of June, 2024. Well done. Thank you so much.
I would also like the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, to please present the next award to Rotary Club of Lagos, Pangrove Estate. The next set of award goes to Rotary Club of Lagos, Pangrove Estate. Are they here? Okay, yes. They are going to back the Community Blood Drive Initiative Award. The Rotary Club of Lagos, Pangrove Estate, chartered in June 30, 2008, is the 81st club in district, growing from 24 to 157 members. The club focuses on health and education in Lagos State and beyond. Notable projects include blood donation camps, initiated in 2015, with 6 camps held this year, collecting over 500 pints of blood. Distinguished ladies and gentlemen, let's put our hands together for Rotary Club of Lagos, Pangrove Estate.
It is my singular pleasure today to present this Community Blood Drive Initiative Award to the Rotary Club of Lagos, Palm Grove, for giving us the highest number of donors as a single organization. I think it can only be left to our imagination how many lives they have saved for us here in Nigeria. So we're really thankful to you for that. We know you're also involved in a lot of other projects, especially health projects. We're really grateful for your interventions. And this award is presented today during the LSBTC 20th anniversary celebration on the 4th of June 2024. We're really grateful. Thank you.
The last award that will be presented by the... Okay, 1 second.
Good evening, everyone. This LSBTS is our second home, and we have a mentor. Davis Madam is our mentor for that. She is encouraging us every time whenever we feel that we have to do blood donation camp. She always encourage us as a Rotarian. And we do this thing because, not because of anything, but we want to do. We find that in the health camp, when we do the health camp, the major problem is the blood. Whenever we have a blood problem, then we always go for it. We find a way out, so that we decided that every month we'll conduct a blood donation camp using our Indian community. So that, but whenever we call them for, this is a second one, all the LSBTS staff are our sisters and brothers of different father and mother, because they are home, they are our next home. Every month, one Sunday they come to our place for the blood donation camp. So we mix up like they are a family. So we want to honor them. They never agree for that. This is the right time to honor them as a 20th anniversary, so that they can grow very good. We will be part of them always, every time. Masikawaya knows us. She is the sweet girl, lady, always say no to us. And Madam Balagun is there. She is a protocol lady. She never allows us any, if you find anything, sir, for the blood donation, the major problem is the blood pressure and sugar. She never allows us to do. If she find that thing, no, it's against the protocol. No. And Inka is there, she is a very strict lady. No, you have to stand like this, sit down like this, don't do like that. She is our so we enjoy as a family. So they are very good in nature. We are very glad to be part of them, and we'll continue to do whatever we can do for them. And he knows better than anybody else, because he is the one who approves for a thing. For one information, sir, the blood donation camp in our Rotary Club is started because the Dr. Leke Pitten was our honorary member in Rotary Club of Lagos Palmguru Estate. He only tell us, as an Indian community, why don't you help Nigerian community to donating blood, because they need it. You have it, go for it. So since then we are continuously doing it. We do it for till we here in this country. Thank you very much, sir.
Thank you very much, sir. Thank you very much, sir.
This time she cannot escape from us. The Rotary Club of Lagos Palmguru Estate, District 9110, and the Indian community, with our greatest appreciation award presented to Lagos State Ministry of Health, Lagos State Blood Transfusion Committee, for our contribution and support to blood transfusion service presented by Rotarian Anuj Muvarka President, Rotarian Mohan Duraraj BDC Chair. So we are giving us an honor. It is our great pleasure and honor to be a part of them and giving the honor award to her. Now you got.
Distinguished ladies and gentlemen, the last award this afternoon will be done by the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, to Rotary Club of Lagos Island. Rotary Club of Lagos Island. Are they here? Rotary Club of Lagos Island. Can you step forward? Rotary Club of Lagos Island was established in 2016 and is part of Rotary International, a global service organization focused on humanitarian efforts, ethical standards, and promoting peace. The club is inclusive, welcoming individuals regardless of race, religion, gender, or political views. It actively engages in various projects.
While the Rotary Club of Palm Grove gave us the highest number of donors, the Rotary Club of Lagos Island supported us with the highest number of donation drives. So today, it is my pleasure to present the Community Blood Drive Initiative Award to the Rotary Club of Lagos Island for their continued support to the Lagos State Blood Transfusion Committee and to the residents of Lagos State as a whole during this 20th anniversary of the Blood Transfusion Committee. on the 4th of June 2024. So presented with all our gratitude. Thank you.
Thank you very much. So distinguished ladies and gentlemen, we are going to have a group photograph. So I implore you, Mr. Governor and others, to please stay while other members join you. So at this point, I would be inviting Dr. Leke Piton, who is ably represented here, the special advisor to the Lagos State Governor on Health, representative, yes, please join them. The senior special assistant to the Governor on Health. The guest speaker. Okay. The guest speaker should please join. This will be the first set of group photograph. Camera, the cameraman, are you ready? Cameraman, are you ready? Okay.
Yes.
The next, I want the body of permanent secretaries to please join the Mr. Governor and other members of the top table. Body of permanent secretaries. The next, I would want the founding members with the guest lecturer to please join members of the top table after this set of group photographs, please. The founding members should please join Mr. Governor and other members of the top table. The guest lecturer inclusive. Award recipients, are you ready? We are going to have the next set of good photograph. Individual and corporate organizations. We are going to have the next group, the next set of good photograph. Award recipients. Award recipients, should please step forward. Award recipients, individuals and corporate organizations should please join the Mr. Governor and members of the top table. Award recipients, please. LOC chairman. LOC chairman. Award recipients, you please join. Award recipients, individuals and corporate organizations, please. Award recipients. Let me talk to her. After this set of photographs, we are going to have medical directors joining Mr. Governor and members of the top table. Medical directors here present should please join Mr. Governor and members of the top table. Panelists should be warming up to join the Mr. Governor and members of the top table. Panelists, after this set of group photograph, panelists. And they will also be presented, awards will be presented to them. Panelists, please. Panelists, please. Panelists and the guest lecturer should please join the guest lecturer and panelists. That are here, heads of agencies, heads of extra ministerial departments and agencies, ESFAMA, please. We need your attention, please. The next, I have professional bodies joining Mr. Governor and members of the top table. NMA, M1, lab scientists, and others. You please join Mr. Governor and members of the top table, please. Kindly step forward for your group photograph. We don't want to keep Mr. Governor waiting. Supporting partners that has contributed immensely towards the establishment of LSBTC. Supporting partners, Fitting Pharmaceuticals, V-Care Foundation, Rotary Club of Lagos, Red Cross, Panguf Estate, St. Canary, Lions Club. If I hear you don't want to keep Mr. Governor waiting, kindly step forward. Please, let's be fast about it. Time is fast spent. Supporting partners, all supporting partners. Banners Diagnostics, please. Kindly step forward. all partners, all supporting partners. After which we are going to have the Lagos State Blood Transfusion Committee Local Organizing Committee. LSBTC Local Organizing Committee should get set. LSBTC Local Organizing Committee. LSBTC Local Organizing Committee. LSBTC Local Organizing Committee. Local Organizing Committee.
So, are you saying the link for them? Wait, no. Oh, recognize.
So no, that's not all, sir. Just we have two more. Banner Diagnostics Limited, Sholawumi Diagnostics Limited, Dialysis Diagnostics Limited. Kindly step forward for a group photograph. They are partners. They are supporting partners. They are feeling left. Are they here? We are now going to have the last set of group photographs. If you know you've not had any group picture with Mr. Governor and members of the top table, kindly step forward to have the last set of group photograph. The last set of group photograph. If you've not had any pictures at all, kindly step forward and join Mr. Governor and members of the top table, please. Distinguished ladies and gentlemen, at this point, I would want Mr. Governor and members of the top table to please proceed towards the cake cutting arena. Mr. Governor and members of the top table should please proceed towards the cake cutting arena. We are going to have the cake cutting now. Yes. Yes, please. PS, sir. Mr. Governor. Founding members, you please join them. Please, founding members. Founding members, guest lecturer. Okay. Thank you very much. At this point, so thank you very much. Karen, and are we good? So at this point, I would want the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Oboye, to please stay back for his closing remarks. Thank you very much. Can we just have our seats and listen to what he has to say? Thank you very much. And at the same time, let's put our hands together for him.
Can we be seated, please? Can we be seated, please?
Can we be seated, please?
Mr. Governor, represented here by the Honorable Commissioner for Health, Professor Akin Abayomi, the Special Advisor to Mr. Governor on Health, my colleagues in the body of permanent secretaries, all other courtesies duly extended. I would just like to first acknowledge the founding mothers of the blood transfusion service who have given their all for the development of the blood transfusion service and for getting things to where they are today. We saw in the little video what it was like before. We know what it is like now, and we have also heard from many of them what their vision for the future is. And I think looking at that video, I see that the future for the Blood Transfusion Committee is very, very bright. There's a lot of new innovations that are in evolution. Many of them are already coming on stream. Automation of our blood screening is already coming on stream. And we're going to get the whole fractionation thing being automated soon from what we're hearing. So there's a lot that is going on. My first interaction with the Blood Transfusion Committee, I remember, was several years ago when they were going to develop their first strategic plan. And I remember Prof. Akisheta saying to me that, wow, I didn't know doctors did things like this as well. But it was fun for us. I learned a lot about TTIs and everything else that was going on there. But more importantly, I learned about the devotion and the commitment of the people that were leading the program as well as the people that were working in the program. I want to recall two incidents. One, the building collapse on Lagos Island a few years ago, sometime between 2017 and 2018, I think. And I know that within an hour or so, the blood bags were distributed to a lot of our health facilities, and messages were sent out to ask people to come and donate. And we were overwhelmed by the number of donors that came in. I also remember the bus train accident that happened, I think it was last year, and the speed with which blood was made available to all the people that needed it at that time as well. And all this is due to the work of the people that had gone before, but also to the tireless and infectious energy of the current ES, Dr. Boduri Oshikomaya. Dr. Oshikomaya can call you or send you a message in the middle of the night and then say, I will see you tomorrow, sir. And she can wait 4 hours in your office if you are busy. No, I don't want you to rush it, sir. When everybody has gone, I will talk to you. And she will wear you down until you hear it and you understand the zeal, you know, what this can create for them. I know there's plans to start barcoding our blood bags. I know there's a lot of good things that are in the offing to make blood safer in Lagos. And I will pray that, because you know, we all just do things without God working on them as well. It's all in vain. So I pray that the Lord also blesses all our plans for the Blood Transfusion Committee, and they all come to fruition as we have dreamt them. So I would like to thank all the people that are here today that have taken the time to celebrate the... Would you like to say something, ma'am? Collection. Okay, just to thank you all for taking there's a lot you could be doing today. I thank you all for taking the time to come here today to celebrate our blood transfusion service. And I call on you all to continue to be a part of the support for the service. And please try and encourage as many voluntary blood donors as you can. Thank you very much, everyone.
So, Mr. Governor, distinguished ladies and gentlemen, at this point, I'm glad to announce to you that lunch is served. Distinguished ladies and gentlemen, I would also like to let you know that an airpod was found. So if you misplaced yours, kindly step forward to get it. Thank you very much. An airpod. If you misplaced yours, kindly step forward.
ló gbà sára mi o. Má jẹun tó dáa, má wọṣọ tó dáa, má gbádùn ara mi, má ṣe fàájì dọ́ba. Bóyá lọ́la ikú lè dé lójijì. Ọlọ́jọ́ kájọ́ ẹ̀dá gbàgbé àti sùn. Màmá ẹja gbà. Máyọ̀ nọ́rẹ́bù kọmíṣánná mi Àbáyọ̀mí Yélò ní tèmi. Àbáyọ̀mí ṣámagbóhùn lẹ́nu mi. Bọ̀bọ̀rí ẹ̀ léde wọn ò ní bèrè aṣọ, wọn ò ní bèrè owó. Àbáyọ̀mí ni ratata mi honourable commissioner. Bọ̀bọ̀rí ẹ̀ léde wọn ò ní bèrè aṣọ, wọn ò ní bèrè owó. Wọ́n náà ya rẹ̀ ń kọ́, wọ́n tún náà ọmọ rẹ̀ ń kọ́. Ọmọ lérè ayé wa ṣẹ̀gbà. Ayé tótó mojúbà ọmọ aráyé. Ayé tótó mojúbà ọmọ aráyé. Àbáyọ̀mí bó bá ń dára fún ẹ wọ́n máa gbé ẹ lọ́kùnrin àtàtà ọmọ jayéjayé. Honorable commissioner mi ratata bó bá nílé lórí o wọ́n máa gbé ẹ lọ́kùnrin àtàtà ọmọ jayéjayé. Bó bá níyàwó tó pẹ́ dẹ́rẹ́ wọ́n máa gbé ẹ lọ́kùnrin àtàtà ọmọ jayéjayé. Àmọ́ tó bá sáfẹ́rẹ́ díẹ̀ o. Àwọn aráyé. Wọ́n máa yín mú, wọ́n máa mọ́jú, wọ́n máa wúkọ́, wọ́n ṣèbọ́ láti tán.
Ọlọ́ọ̀tọ́ lọ́kùn sẹ́yìn o.
Wọ́n ṣèbọ́ látán.
Ọlọ́ọ̀tọ́ lọ́kùn sẹ́yìn o.
Honorable commissioner Àbáyọ̀mí mi. Ọlọ́láyé mo bá ròde gangan.
Ọlọ́ọ̀tọ́ lọ́kùn sẹ́yìn o.
Jayéjayé la lárọ̀ mi. Àbáyọ̀mí mi ratata kọmíṣánná. Wọ́n ṣe bọ́lá tán. Wọ́n ṣe bọ́lá tán láòtọ́ o. Láòtọ́. Ẹ bá mi dájú Àbáyọ̀mí mi dáadáa. Honorable commissioner mi ratata ó ṣe. Láòtọ́. Kẹ́nikẹ́ni máa nà bọ̀bọ̀ yẹn.
Ara wa ni,
kẹ́nikẹ́ni má nà bọ̀bọ̀ yẹn.
Ara wa ni bàbá yẹn.
Sílò 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 sílò.
Sílólóló, sílólóló, síló.
Sílò 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 sílò.
Sílólóló, sílólóló, síló.
Báyìí kọmíṣánná mi Àbáyọ̀mí yé ló ní tèmi. Sórí owó lórí ẹ kò fẹsọ̀ má jayé. Kọmíṣánná sórí ọlá lórí ẹ kò fẹsọ̀ má jayé. Ó ṣe ló ṣòwò òun ìmọ̀ bàjẹ́ ló ṣòwò òun ìmọ̀. Ọgbórí pẹ́tẹ́ sì wá ló gbà láyé wọn borí pẹ́tẹ́ sì. Sórí owó lórí ẹ kò fẹsọ̀ má jayé. Nado èmi nado. Èmi nado.
Èmi nado.
Ìjó tí mo jó lánàá.
Èmi nado.
Bàbá ro gbọ́dọ̀ gbọ́.
Èmi nado.
Màmá ro gbọ́dọ̀ gbọ́.
Èmi nado.
Ẹbí ro gbọ́dọ̀ gbọ́.
Èmi nado.
Ọ̀rẹ́ ò gbọ́dọ̀ gbọ́.
Èmi nado.
Bọ̀dá yé ṣe o.
Yéṣe o.
Bọ̀dá yé ṣe o.
Yéṣe o.
Ilẹ̀kẹ̀ tí mi tó fà yí gẹ́.